Hi Adriana, my name is Emily. I'm going to be your nurse for the day.
Hi.
Could you please tell me what brings you in today?
So I'm struggling with anxiety, or I'm in nursing school and I'm struggling with anxiety, and it's really not only affecting me, but it's affecting my family as well, and it's like making me like really nervous, and I don't know what to do about it, so I came here.
Okay, can you describe the symptoms you're feeling? What activities are you involved with throughout your day?
So when I experience anxiety, I get like a tight feeling in my chest. I start shaking. I get lightheaded, like I can't like control it. Sometimes I get like really panicked and I'll start to cry. I feel like hopeless and depressed like all the time. When I have severe attacks, I feel like I can't control my body at all, and it's like really hard to concentrate, and it's like tough with nursing school because I really need to study for my exams, and like if I get this way, then I can't study. But like other than like studying, I guess I just like watch Netflix all day and like sit in my bed, but that's about it.
When are you experiencing these symptoms? Is it like morning, night? Do you know what triggers the stress? Is it only when you have a test coming up, or is it like frequent when you are just doing daily activities?
I'm sorry, I might get really emotional right now, but I think it's because of like the exams coming up, and like I get really anxious, and like right now I'm really anxious just talking to you, and I wish I knew what controlled them. I'm sorry, I need a minute.
Nurse Emily ended the interview at this point. She did not want to overwhelm Adriana at such an early stage. Since then, they had worked on several cognitive behavioral therapies in an attempt to help Adriana with her behavior. Emily talked to the doctor about what medication to prescribe Adriana for her panic attacks. The medication they decided to prescribe Adriana was Zoloft 50 milligrams and Ativan 0.5 milligrams. With these medications, it is important that they are gradually increased until a stable anxiety level is reached. Once this occurs, Adriana will slowly taper off the medication as prescribed. Nurse Emily wanted to speak with the family members to see how they were handling the situation. She talked with her sister, who seemed to be taking it the worst.
So my sister is like my best friend, and I'm really concerned with all of her behaviors regarding her anxiety because she has so many panic attacks, and I know that she was saying before how she feels so helpless in the situation, and I guess it's not helpful for me because I feel helpless as well. Her emotions are so uncontrollable and she can't focus on what's going on around her. I get nervous because I see her breathing begins to change, and I don't really know what I'm supposed to do when like she's having trouble breathing. I mean, she's panicking and it just makes her more upset, which obviously upsets me, and I'm worried about my sister because I know her father suffers from anxiety, so I was just like, he's been hospitalized in the past, so I didn't know if it was kind of like a familial thing, like if it's passed on through genetics and stuff like that.
Well, yes, genetics definitely plays a role in anxiety. Research shows that anxiety is passed down from generations, and it's commonly seen throughout families. Really good that your sister has you for support. I can teach you therapeutic ways on how to assist your sister through this difficult time. The most important thing is to avoid asking why questions. Although you don't know what your sister's going on, she doesn't know either. So by you asking why questions, it's just making her have more anxiety and get more stressed out.
Adriana described some of her symptoms, but not all patients have the same symptoms. Some of the other symptoms of panic attacks include impending doom or death, rapid heart rate, sweating, trembling, shortness of breath, hyperventilating, chills, hot flashes, nausea, abdominal cramping, chest pain, headache, dizziness, faintness, a tightness in the chest, and trouble swallowing. Cognitive responses to anxiety are impaired attention, poor concentration, forgetfulness, errors in judgment, preoccupation, blocking of thoughts, reduced creativity, confusion, loss of objectivity, fear of injury or death, flashback, or even nightmares. Cognitive behavioral therapy is broken down into two different categories when working with patients with anxiety: cognitive restructuring and learning new behavior. Cognitive behavioral therapy has been shown to be most effective in treating anxiety. Another approach is to help a patient modify behavior and learn new ways of coping with stress.
How have you been since the last time I saw you? Can you tell me what your daily routine is now?
So I've been like really good since the last time I saw you. Like I've been waking up and going to the gym. I've been like hanging out with my friends more. I volunteer at a hospital. Like I feel like I've made like a lot of progress.
Working through this problem-solving or re-educating process with the patient takes time, and the nurse must be patient.
Wow, it seems like you're doing so much better. I'm so happy to hear that. Have you seen any changes in your behavior since you've been prescribed your medication? Are you taking Zoloft 50 milligrams as prescribed? Are you also taking your Ativan when you are experiencing a panic attack or starting to feel an increase of stress, anxiety?
Yeah, I've been taking my medication daily, and anytime I get like a panic attack, I'll take the Ativan, and it really calms me down. Like I feel like the medication has been like really working for me. I feel like a whole new person. Like I feel much better. Like my symptoms seem to like disappear.
Great. It sounds like it's been very effective and it's a good method that's working for you. How do you feel after meeting with your psychiatrist?
Well, while meeting with my psychiatrist, he taught me a strategy to change my behaviors. So I was able to see these changes in just my daily routine. I now go to the gym and I volunteer at the hospital. I'll hang out with my friends, and I'll actually do things instead of just laying in bed all day like I used to do and watching Netflix. I feel like I'm more active now. And I also realized while going through this therapy that I can't focus on the exam. I have to take it one step at a time. I can't worry about an exam that's a month from now when I have a quiz next week in a different class. So I feel like I have to take it one step at a time. And I stopped my what if thinking. I stopped thinking what if I'm going to fail the exam, because it just set myself up for failure. And when I sat in group therapy, I was able to observe others, and they had really positive behaviors, and it really changed my perspective on things.
I'm so happy. That's really great. It's great to hear that you aren't letting your stressors control your life anymore.
Yeah, it's very less negative than what
less negative. Good. Kylie, what changes have you seen that you can tell me with your sister?
I've seen a lot.
Okay.
So now that she's taking medication and going to therapy, I've noticed that she's so much more optimistic than she used to be. She used to be so negative about life, and now it's just a whole rush of positivity. It's awesome. Her panic attacks are less frequent. She's no longer just sitting around doing nothing like she was saying before. She's up and about and doing something constantly throughout the day now. For example, I'll ask her to come to the mall with me. Normally before she'd be no, I don't really feel like it. But now she's up and ready to go, and
Good.
we're right out the door. So it's really good. I notice she studies for exams more, and when she's studying for her exams more, she's definitely more focused on the content rather than her anxiety and not being able to learn everything or do bad. You know what I mean? She's just focused on what she's actually learning, which is good, and I'm happy with how she's acting. I feel I finally have my sister back.
Good. And then what changes have you seen in your sister's behavior?
So I've noticed that she stopped asking me why questions, why is this happening, or why am I acting like this? And she'll also sit with me when I have a panic attack and hold my hand, make sure I take my Ativan, and that's really important because when I'm having a panic attack, I don't recognize anything. And she makes sure that I don't feel alone, and she's very helpful with that.
Good. You're never alone. You have your sister for support. Let's talk with your doctor and see if he wants to continue with this therapy and that this is going correctly. And from my point of view, I think it is, and it's really great to hear that you both are doing well.
Yeah, that sounds great.
Good.
What Adriana is experiencing are several examples of cognitive behavioral therapy. The first one she describes is called shaping or modeling. Both of these reinforce behaviors that focus on positive attitude. After the patient observes this behavior, the psychiatrist and the patient work together to practice it before they practice it on their own. This allows the psychiatrist and the patient to develop a more therapeutic relationship. With shaping, the doctor waits until they see the positive behavior and give the patient positive reinforcement. Another cognitive behavioral therapy is called thought stopping. This is when the doctor uses verbal reinforcement when she notices the negative thinking is back. For example, if Adriana was to start speaking negatively about herself and her confidence for her exam, the doctor may shout the word stop out loud so Adriana knows that her thinking is back to her old habits. By the end of this form of therapy, the patient will be able to interrupt their own thoughts without needing the verbal command of a doctor. The last form of cognitive behavioral therapy that Adriana experienced was called decatastrophizing. This is called the what-if thinking technique. This helps the patient visualize whether they are overestimating their situation. The nurse may ask questions such as, what is the worst thing that can happen? This overall helps to see if the consequences of the patient's actions are probably not as bad as they think.
So based on everything that we've discussed, my sister and I have learned that many things are beneficial to treating anxiety. Now we know the cause of her anxiety and how to relieve the stressors that she experiences. She's now prescribed medication, and it's important for her to adhere to the strict guidelines that the medication gives. I'm really glad I was there with her to learn these rules so I can help her out. Along with medications, it's important that she keeps attending her weekly therapy sessions in order to learn new coping mechanisms and practice them often. It's important for my sister to have a good support system with people who understand her situation. It's also good that I was able to learn right alongside with her ways to deal with her condition. Lastly, we know that if her stressors are getting out of control again and her condition comes back, we know how to contact the doctor to prevent a relapse and continue progressing to be as stable as she can be.
Overall, many students are probably dealing with situations similar to Adriana. Some of these students may not be getting the help that they need. I hope by seeing this episode that students see how important it is to take care of themselves and to get the help that they need. It is important to manage their anxiety. You guys are not alone, and there are plenty of resources out there to help you. There are many nurses, like Nurse Emily, that will provide direct patient care, plan treatment programs, and teach others the behavioral techniques to relieve the stressful situations. There are other support systems than family members, so you never have to feel like you guys are alone.
I'm sorry. I need a minute. Is that good?
Yeah, perfect.
Okay.
Research. Oops. Shoot, I lost my place. Darn it. Sorry, guys.
It's okay.
Sorry.
Emily talked to the doctor.
Wow.
Rapid heart rate.